My name is Claire, and I'm a nurse. I research baby talk, but not baby talk to babies. What I look at is the impact of baby talk to older adults, specifically those living with dementia. Let me illustrate this for you. Let's say I have two patients, and both are male farmers from Iowa at the hospital for abdominal pain. My first patient is middle-aged, and my interaction might go something like this. Hi, Mr. Smith. I hear that you have abdominal pain. Is it all right with you if I start an IV? Seems pretty typical, right? Now let's say my next patient is an older adult living with dementia. My interaction may now look like this. Hi, bud. I heard that your belly really hurts. I'm going to go ahead and give you a little poke. That's okay with you, isn't it? Now, you can see that both of my patients had the same characteristics, except that the latter was an older adult with dementia. And that difference alone caused my communication to be very different. We call this Elderspeak. We know that older adults of all types experience Elderspeak, but it's most common with persons living with dementia and those with functional declines. We also know that older adults generally don't like to be communicated with this way and find it patronizing. And we know that Elderspeak results in challenging behaviors by residents with dementia in nursing homes. I'm interested in the impact of Elderspeak in the hospital setting. For my research, I spent the past year at the hospital recording and observing care encounters between nurses and patients with dementia. The patient's behavior was coded for resistiveness to care. This includes 13 specific behaviors like yelling, hitting, and crying. And I witnessed all 13 of these behaviors occur. Then the audio recordings were coded for Elderspeak on numerous communication domains. And once again, all of the domains were used by the nurses. Specifically, I heard nurses say childish things like, scoot your bottom, or minimizing phrases like, it's all right, dear. Finally, I will be using statistical modeling to determine if Elderspeak by nurses leads to resistiveness to care by patients with dementia. Resistant care in the hospital is important to me because patients at the hospital need quality nursing care to get better and go home. But if they resist that care, then that won't happen. I can tell you that nurses care. They care so much for their patients, but the way they communicate this care may be all wrong. Elderspeak does not come from a place of malevolence, but it does represent a form of subconscious ageism. My goal is to help educate nurses on how to best communicate with patients with dementia, to show they care without infantilizing them. Thank you.